Right, so welcome back everybody. Today I have a special guest. You can notice this isn't Ross, this is Paul Freeth, and you work, what's your exact role?
I'm a peer support worker at Littlemore Mental Health Hospital.
Exactly, okay, cool. And you're using the chessboards?
Using the chessboards, which the patients totally love.
Yeah.
And basically for the purpose, the patients when they're on the ward don't have a lot of activities to do.
Right.
So they have a lot of time to sit and ruminate and then at times get worked up. So this is something that can be used just to give them something else to think about.
Yeah, and like distract the mind.
Distract the mind.
What type of people are you working with?
I
guess by that I mean, what kind of like illnesses are common on the ward?
Yes. Got to be a bit careful.
Yeah, no, absolutely. Yeah.
Mental health patients.
Mental health
people
patients.
with mental health issues.
Yes, yes.
And addiction issues.
Sure.
But yeah, got to be a bit careful.
Yeah, no, absolutely. And so with the chess boards that you're using, the 5-a-side chess boards, how do you kind of interact using them? Do you kind of go out and get patients to play with each other, or you play with them?
I play with them.
Yeah.
More.
Yeah.
And as at the moment, I'm quite new to the job.
Right.
So what I would like to do is to set up a bit of a league for the patients.
Okay.
So because there's a number of sites around Oxford, like the Warnford and Littlemore.
Yeah.
So we could get a few competitions going.
That's
and
interesting.
Get a league, and that way, because patients have a lot of quiet time in the evening.
Yeah.
When not a lot is going on, there's no doctors.
Yeah.
So if we can start up a bit of a league and get them playing one another,
that's such a good idea.
And it just makes it a bit more, gives them a bit more of a challenge, and again it gives them something to focus on. And when I spoke to one of the ward managers the other day, he was saying how big chess was on the wards.
Really? Already? So like a little 5-a-side chess league
would be
with the different locations.
Yeah.
That's such a good idea, because then you've got that engagement, and then people have got something.
You've got
to
that
look
engagement, and it gives them something to talk about.
Yeah.
Because I think, from my own experience of having psychiatric illness, you have too long to think.
Right.
And when you're in hospital, and I've been in hospital many times, when you're in hospital, you just think, and you think, basically, what can I do? And by playing chess, there was one gentleman, for example, when I was on Bourne Thomas, who we would play all day from 10 o'clock in the morning until 6 o'clock at night.
Really?
And non-stop. But it got me better, and it really did help me form part of.
Really? Why do you think that is?
Gave me something else to think about.
Yeah.
Rather than thinking, oh, I'm depressed, I'm suicidal, or anything like that, I was thinking,
and you can't think of much else when you play chess, can you?
No.
It's one of those games where you gotta be.
Yeah.
It's everything.
And also, I think as well, with chess and patients, and anyone in particular, brings out that competitive side to you.
Right.
And I think that's good for patients, rather than just play, because a lot of people do know how to play chess, and for those that do know how to play, having that competitive edge makes them want to do it again and again and again.
Right.
And by doing this, it takes pressure off the nurses, especially with the NHS, the way it is at the moment.
Right.
Patients were taking a lot of the nurses' time. So being a peer support worker and playing chess just gives them a chance to do their paperwork and other things.
So you're taking the strain off of the
Taking the strain, and I think this is why I think peer support was introduced, because basically as a peer support worker, we're there to help patients for our own lived experiences.
Right. So you've got that perspective.
So you've got that
relate.
Yeah.
And so how do we come up with solutions that are creative?
I think initially you've got chess. Maybe once the chess has really taken off, not just within Oxfordshire, but within other areas. Maybe you can then start to introduce other games. That people like backgammon or things like that.
Definitely, I think.
And I think that's how the business could expand.
Sure. Yeah, I think you're right. What if you're playing like you against a patient, for example? What would you notice a difference in from when they started and when they finished?
Yes, especially if they were to win. I'm quite competitive, and
Right.
I like to win, but if they win, it puts a smile on their face.
Okay.
And when you work with patients, and I know again from having been a patient myself, to see someone smile in that environment is the most incredible feeling.
Wow.
And I always say to myself, if I can get one person, even when I was doing my training, if I can get one person to smile each day, then I've done something
all right.
right. I've done something right.
That's really, really awesome, basically. And so, some people are kind of smiling after they play. I'm sure you said something about people just being a little bit more calm.
I think chess brings on calmness.
Right.
Because you've got, when you're in a ward environment, especially for those people who don't have leave, they're on that ward 24 hours a day, and it's not even a garden that they can go out into.
Right. So that's just looking at the walls.
That's just looking at the walls, walking around, trying to get more medication out of the doctors. Everyone always wants more medication
Really?
on a ward. I know that from my own experience.
Sure. Is that just to kind of get rid of the time?
Get rid of the time and get yourself to sleep.
Right.
But it's different. We're all individuals, and people have different severities of illness.
Of course. Yeah.
So, but yeah, it's good.
Yeah, that's really, really good. And do you think, like, you can improve what's going on the wards? I know you said about the league, but are there ever, what are kind of like the issues that you think can be improved at the moment?
I think the chess is brilliant as it is. I think it's something that will develop as time goes on.
Yeah.
I think, for example, meeting that lady like we did earlier.
Yes.
People like her, people like Will, who I passed the paperwork on to Dan.
Yeah. Oh, Will, the guy who.
Will Gibson.
Will Gibson. That's
who's my boss.
Yeah.
So I think as time goes on, it will develop more and more.
Have you found, because you're obviously playing it on the ward, but what have you found about today? Because obviously you're here in Oxford at the market.
Today has been superb to see the interest that people have shown, to see the bus, to see the messages that people have left, to see the energy and passion that yourself and Moss give to it. It's good.
Awesome. Maybe. Well, it's been a pleasure having you. We've still got some of the day left, so let's kind of go back outside and play some chess.
Yeah.
Thank you so much, Bob.
Brilliant. Was that okay?
That's great. That's absolutely great. Brilliant.